Welcome to The Explainer. Today, we're looking at a truly surprising and, frankly, potentially life-changing medical breakthrough. We're going to explore how common heart medicines, those everyday pills millions of people take for their physical health, are now being used in a completely groundbreaking way to fight depression. It's all coming out of a fascinating new study from AIIMS, and the implications for psychiatric care are absolutely massive. Okay, let's dive into this. It sounds almost like science fiction, right? I mean, we usually think of the cardiovascular system and our mental health as needing two completely different medical toolkits. But the central mystery we're unpacking today is this. Can a standard blood pressure pill actually unlock a better, stronger response from psychiatric medication? Well, to figure out why researchers even started asking this question in the first place, we've got to look at the sheer scale of the problem we're trying to solve. 18%. According to researchers, depression accounts for nearly 18% of the global disease burden. Just take a second to let that sink in. Almost 1/5 of the entire world's disease burden is tied up in this one single condition. We're talking about a massive, widespread health crisis impacting millions of individuals, their families, and their communities. It demands our urgent attention, and more importantly, it demands treatments that actually work. So here's our roadmap for today. First, the antidepressant shortcoming. Second, a surprising medical crossover. Third, inside the AIIMS study. Fourth, the science of the boost. And finally, a new path forward. Section 1. The antidepressant shortcoming. Before we can fully appreciate this new breakthrough, we've got to look at the MDD1 India study to understand exactly where our current treatments are falling short. Because for a huge portion of the population, standard antidepressants just aren't getting the job done. Current treatments are often totally inadequate. In fact, only about 66% of patients actually respond to their treatment after 6 weeks of therapy. That means a full 1/3 of patients aren't responding adequately to our current standard of care. So, the crucial point is that while 66% might show some kind of response, a mere 37% of patients actually achieve remission. That leaves a massive majority still struggling with depressive symptoms, even though they're actively seeking help and taking their prescribed medications. This shockingly low remission rate is exactly why the medical community is desperate for a new, innovative solution. Section 2, a surprising medical crossover. And this is where a brilliant, incredibly hopeful strategy emerges. The core idea here is repurposing existing classes of cardiovascular drugs for treating depression. It's a really smart pharmacological move. Think about it. Instead of spending decades and literally billions of dollars developing a brand new psychiatric drug from scratch, researchers are looking at medicines we already know are safe and widely available and testing if they can basically do double duty. We're going to explain this in detail with subtitles so you can easily follow along with the medical jargon. The specific cardiovascular drugs being repurposed are known as ACEIs and ARBs. Now, don't let those abbreviations intimidate you. Angiotensin-converting enzyme inhibitors, ACEIs, and angiotensin receptor blockers, ARBs, are just routinely prescribed medications. Seriously, if you or someone you know is being treated for high blood pressure or heart disease, there's a very high chance they're already taking one of these everyday pills. Section 3, inside the AIIMS study. To really test this idea, a multidisciplinary team led by Professor S.C. Sarangi at AIIMS in New Delhi designed a prospective study comparing two distinct groups. They worked alongside experts from psychiatry, nuclear medicine, biochemistry, and a collaborator from Kiat Ghaziabad. Out of 166 patients with depression, plus an extra 20 healthy volunteers they tracked, they isolated two cohorts. Group 1 was 102 patients getting standard antidepressants alone. Group 2, the combination therapy group, was 64 patients taking those standard antidepressants, but who had also been taking these blood pressure medications, the ACEIs or ARBs, for at least 3 months. The results after just 6 weeks of therapy were incredibly dramatic. Now, what's really interesting about this slide is the stark difference in the numbers. The group taking only antidepressants saw their depression scores drop from 21.97 to 13.24. Hey, that's a solid drop. But Group B, the combination group taking the blood pressure meds, they started at a very similar score of 22.19 and plummeted all the way down to 10.61. That is a significantly greater fall in depression scores, proving they were way more likely to achieve a clinically meaningful treatment response. Section 4, the science of the boost. To really grasp the why behind these numbers, let's move to and see how this builds while we explain the biological mechanism in detail with subtitles. It's basically a 3-step chain reaction. Step 1, Patients taking ASIs or ARBs naturally have lower levels of a specific hormone in their body called angiotensin II. Step 2. While this hormone is super well known for regulating blood pressure, the study confirms it's also heavily linked to mood regulation. Step 3. By lowering this specific hormone, the biological environment in the body changes and patients experience a significantly boosted antidepressant response. It's just a fascinating chemical domino effect. Section 5. A new path forward. So, what does this crossover discovery mean for the broader medical community and really the whole future of psychiatric care? Well, the international community is already taking notice. This isn't just some obscure small-time finding. This vital discovery by the AIIMS multidisciplinary team was actually awarded Best Research Paper at the 34th European Congress of Psychiatry 2026 in Prague. It's a globally recognized breakthrough that was published in the Conference Supplement of European Psychiatry. And this brilliantly illustrates Professor Sarangi's reminder of the massive stakes here. 18% of the global disease burden and a third of patients completely left behind by current medicine. Finding a way to use everyday cardiovascular drugs to close that gap, it's not just good science, it's a literal lifesaver for millions of people currently suffering without adequate relief. I want to leave you with this final provocative thought. We've just seen how a standard pill for high blood pressure can dramatically transform depression treatment. It kind of makes you wonder, right? If a simple heart pill can unlock better mental health, what other existing everyday drugs sitting in our medicine cabinets right this very second hold hidden cures to the world's most stubborn diseases? Thank you so much for joining me for this explainer, and keep questioning what you think you know.